So if you have a tenacious piece of calculus, a deposit, you can use a Hirschfeld file, and you can see they have 3 little cutting edges. And what these do, these 3 cutting edges go on the deposit and break it up. So with this instrument, you don't want to make a 70 degrees. So if I made a 70, it'd be up like this, and I'd only have that like last cutting edge on the tooth or the calculus. I want it nice and straight, so that terminal shank should be lined up with our tooth. So what we do is we just kind of wiggle it down to where our deposit is, lots of lateral pressure, short baby stroke. Like I just want to be on that 100% calculus. I don't want to be on the root. Break it up. That's it, 2 or 3 strokes, wherever your tenacious deposit is, and that's it. So now I can go back with another instrument and feel, and this will just show, it'll kind of be like more bumpy now. The calculus should still be on there, but now it has more of an edge, so I can get my ultrasonic, my hand instrument, to actually remove that deposit now. This is really good for tenacious, super good for burnished if you have a smooth surface. Now it'll be bumpy, so I can get an edge to it and remove that calculus. So files are great to have on hand. Do I use them on every patient? No, just patients that have lots of burnished or tenacious deposits.